بسم الله الرحمن الرحيم. أتعرف باسم حضرتك.
اسمي محمد مصطفى محمد.
من هنا يا حاج محمد؟
من القاهرة.
من القاهرة. أهلا وسهلا.
أهلا بك.
أنت تعرف إحنا بنصور الفيديو ده لتعليم الطلاب طريقة الفحص الصح عشان يطلعوا دكاترة محترمين.
إن شاء الله.
عندك موافقة على كده ولا مش موافق؟
إن شاء الله.
موافق. إن شاء الله. نبتدي إن شاء الله. إحنا هنتكلم عن subcutaneous swelling lipoma. Lipoma, this is a lipoma in that patient. Lipoma is a benign neoplasm of adipose tissue. This is a subcutaneous lipoma. Lipoma may occur at many sites. We study now the subcutaneous lipoma. The subcutaneous lipoma may be simple lipoma composed of benign adipose tissue only, or it may be combined with fibroma, fibrolipoma, or angiolipoma, a component of vascular component with the lipoma. Here is the lipoma. This is the lipoma. It is hemispherical in shape. Skin over it appears normal. We feel the local temperature in comparison with other near site. There is no hotness. We start with inspection first. Inspection of lipoma shows this tissue, this neoplasm, hemispherical in shape, well-defined margin. Well-defined margin here and ill-defined margin there. There is no redness. There is no scar over it. There is no pigmentation. We speak about the site. The site of that lipoma is at the back of the neck and the upper chest region. The site. The size in inspection is approximately expressed in centimeters. The longest two dimensions, here, from here to there, and from here to there. Two perpendicular planes, dimension. The shape is hemispherical. The surface appears smooth on inspection. Site, size, shape, surface, discoloration, no discoloration. Okay, this is the inspection. Palpation. We feel first by the back of the hand, by back of the fingers, the local temperature. We compare other site away from the swelling. There is no difference in the local temperature. There is no hotness. Also, we express the swelling and notice the expression of the face of the patient. If there is tenderness or not, the expression of the patient will show the examining doctor whether this swelling is tender or not. We measure by a measuring tape. In the inspection, we estimated it roughly. But on palpation, I should measure by a measuring tape like that. This one dimension, and that is the other one by palpation. There is no ulceration, and we know, examine the local skin. Normally, the local skin, it is not attached to the local skin. I can pinch the local skin like that. It is not attached to the local skin. In some lipoma, especially the fibrolipoma, there is fibrous tissue anchoring the neoplasm to the skin. When I try to pinch the skin like that, there is some tethering and anchoring of the surface to the depth of the swelling. The skin here is free. Mobility. I should test the mobility of the swelling in two perpendicular planes, like that. It is mobile at the depth. It moves over the depth of the normal tissue. It is not fixed in the two dimensions. It is soft in consistency. Soft in consistency. The consistency in general. Soft, I can know the interpretation of palpation by examining the web space of my hand. When I feel the web space of my hand like that, while my fingers are relaxed like this is the soft consistency. On contraction of the hand muscles, the consistency is firm. And palpation of the nearby bones, hard. Soft, firm, hard, and cystic or soft tissue. This is not cystic. The feeling of a cystic swelling, like a feeling of an inflated balloon, the cystic. And heterogeneous consistency composed of different ingredients or different parts, not smooth, not one single tissue. Here, the lipoma is soft. There is the slip sign. It is done like that. When I follow my finger towards the edge, my examining finger slips down like that. This is the slip sign. I feel it. My finger is gliding from the surface of the cyst towards the margin. The slip sign. We do cross fluctuation of the swelling. Cross fluctuation is done by pushing the swelling from one side. The pressure is felt by the fingers of the other hand. And we push by that and feel by that. This is the cross fluctuation. It shows here there is fluctuation. But fluctuation, when occurs, when be felt in a cystic swelling, it is called fluctuation. But fluctuation in soft tissue swelling, it is called pseudo fluctuation. Here, this fluctuation is a pseudo fluctuation. It is not a true fluctuation. You see, I push the swelling, it goes up, push the swelling goes down. This is the fluctuation, cross fluctuation tests. The other fluctuation tests, if this is very small swelling, I can't do cross fluctuation. I do Paget's test. The swelling is between my index and thumb. I press over the center. When I feel the pressure waves by the two receiving fingers, this is the Paget's test for small swellings. The third fluctuation test is done for globular swellings, like the scrotal swellings. We press over one pole and feel on the opposite pole, and turn the feeling one to press and the pressing one to receive the pressure wave. We don't do percussion for soft tissue swellings, except in the abdomen or in the chest we do percussion. For lipoma, we don't do percussion. It doesn't contain air. The site, the size, the shape, the surface here, it appears smooth, but in that patient, I feel some irregularity at that part, which doesn't appear on inspection, but I can feel it by palpations, lobules of fatty tissue. These are size, shape, surface, consistency, edge or border, and fluctuation. This is the lipoma. Thank you very much.